Hey, good morning. Dr. Joel Templeton here at Spinal Rehab in Pleasant Grove, your Pleasant Grove chiropractor, where we offer short-term chiropractic care to get you out of pain as quickly as possible. So today I haven't done a blog for about 2 weeks now. So today I want to do just a little bit of a video blog instead of a written blog post. I hope a lot of people take the time and watch this. So this last weekend, I was at a conference doing some continuing education hours. And so as a chiropractor, we have to do 24 hours a year of continuing education. And so it ends up that we have to do quite a bit of continuing education every year. This last weekend, the education and the work that we were doing was a lot about car accident injuries and really what happens in those injuries, and more importantly, how to treat those injuries the right way and document them. And so I want to just take a second and just kind of talk about some of the things that I thought were important that I think would be important to you as well. The first is that when you get in a car accident, typically what happens is a lot of people think the injury is to the muscles. You hear the term soft tissue injury, or I'm just achy and sore, or whatever it might be, and they think it's a muscle injury. In reality, it's not. That's typically the last thing that's injured. The injuries are usually more severe, and if not treated properly, can become very chronic. One of the first things that you'll see when somebody's in a car accident is you'll see a change in the cervical curve. Okay, normally in the cervical spine you have this nice C-shaped curve. Well, when you get in a car accident, it causes these really massive forces to the head and neck that then will cause that curve in your spine to be straightened. Okay, I'm going to put a couple pictures in here as well so you can kind of take a look at it. But a lot of times, somebody's in a car accident, we'll take them in, we'll shoot an x-ray of their spine, and we'll see this straightening of their spine occurring. And what happens is when that occurs, sometimes it's associated with pain, sometimes it's not. But if you leave it, if you do nothing to try to help correct that injury to the spinal alignment, it will cause your spine to wear out more rapidly. It will cause down the road, maybe 6 months, maybe 2 months, maybe 5 years, who knows, but it will cause increased neck pain. It can cause headaches. It can cause disc problems, herniated disc, degenerative disc, things like that if you don't treat it the right way. And a lot of times when we're talking about our spine, people wait till they're in pain to do something, but yet we go to the doctor, we get blood work to check our cholesterol, to check our blood pressure. We don't wait. Sometimes we do, I guess, but most people try not to wait for chest pain to check their cholesterol, to see if they have risk of a heart attack. Why in the world do we wait for us to have pain after an accident? And sometimes it could be 6 years. Why do we wait to do something when it comes to our spine? Whereas if we do something sooner, it's much easier to fix, much easier to manage the symptoms and the pain and to get it better if we do it right away. The second thing that we talked about is not only do people get an injury to the curve of their spine, where it goes from a nice C-shaped curve to straight, but we actually see injuries to the facet joints. So in your spine, you have these little joints in the back of your spine right here. Let me see, get that up close. So right in here, okay, right there. Between these two vertebrae are facet joints. Kind of separate that right there. And that facet joint is what allows you to bend and move, okay? Well, there's a ligament that goes all the way around that facet joint, okay? All the way around. It's called a capsular ligament. And when you get in an accident, many times that capsular ligament gets injured. Sometimes the bone itself in the facet joint gets injured. And so what happens when that gets injured is that sometimes it will cause pain right in that area, but most of the time it causes what's called sclerotogenous pain, which is pain that kind of refers out to the muscles. And I'm going to put a picture of what sclerotogenous pain is, and when you have an injury to a specific facet joint, where that pain will refer. And so a lot of times that's what people feel, is this muscle achiness, but it's deep down inside. And again, if we don't address that actual injury of the facet, try to rehabilitate in that facet to make sure that it heals the right way, it will become chronic, that pain becomes chronic, and it becomes a huge issue down the road. And so I encourage you that if you have been in a car accident, you have a car accident injury, if you know somebody that's been in a car accident, has had a car accident injury, to get in and get checked out. X-rays are cheap. To go in and be able to see what's going on, to see if these injuries are there. Evaluations are cheap. If there's nothing there, great. Get a clean bill of health. You're good. Make sure, and you can go on and just do your thing. If there's something there, then we can help you to get that fixed. The last thing is that, you know, as I was there and we talked a little bit about insurance companies, you know, insurance, especially auto insurance, covers the treatment when you've been in a car accident. But these insurance companies really, they're not your friends. The adjusters are not your friends. They have a job to do, and their job is to protect the insurance company. And so I'm actually going to post a video that was done by Allstate that it was a training video for their adjusters. And it's just crazy to me that they would use this video to train their adjusters, and the science they use is bogus. There has never, as you watch it, there's nothing that backs up this information that they teach their adjusters. And so they're not really there to really look at science and what's going on. And so, you know, if you've had an accident, don't go off of your pain. You know, don't, like somebody that has a heart attack, don't wait for the heart attack. Get your cholesterol checked. Get your spine checked. Make sure it's okay, right? Get in and let's do some x-rays, which are inexpensive. Let's do an evaluation, which is inexpensive. Make sure it's okay. If there's some injury there, we can get it going, get it fixed, do what we need to do to make sure that long-term you're okay. So call us at our office, 801-492-9300. What we'll do is an evaluation, x-rays. Anybody that's been in a car accident, this is ongoing. We will always do this. We'll do the evaluation. There's no cost to you. The insurance company pays for all of that evaluation. We will also do a 30-minute massage, and there's no cost to that. You know, if you don't have a car that's been totaled because of an accident, we have a van. We'll come pick you up. We'll get you to our office, take you back home or work or wherever you need to go. So there's no reason to not get evaluated. We can pick you up. We have the most convenient appointment times, whatever it takes. So take a look at these other pictures. You know, take a look at the other information that's on here. Call us, 801-492-9300, and just get in and get it checked out. Thanks for listening, and hope you